Hello, welcome back. Today we are talking about swollen feet, causes, reliefs, and quick tips of how to take care of it at home. If you're interested in this topic, stay tuned and let's keep rolling. Welcome back. I'm Carolinda with Extra Steps Foot Care. Do your shoes feel tight when you come back from work? I know what that feeling is. It might be your feet swollen. So, what are some of the causes for this swelling in your feet? The first cause might be from prolonged walking or standing. When you walk too long or stand too long, the blood pulls down in your leg and it might cause swelling at the end of the day. Sometimes sitting too long too will also cause the pulling of blood in your legs. Another cause might be for heat and humidity. The veins in your legs are like a pipe. We all know when it's hot, it expands, and when it's cold, it shrinks. So when it's hot and humid, it expands. And if you have poor circulation and vein issues, it's difficult for it to go back up to your heart. So it pulls down in your legs. The heat might just be one of it. Another thing might be salt, high sodium intake. Once you're eating too much salt, and a lot of things contain a high amount of sodium that we usually don't even think about. So be mindful of what you're eating. Make sure that you are reducing your sodium content because that might be the reason why your leg is swelling. Another thing might be your medications. Some medications have that as a side effect. We call it edema. We might also have things like medical conditions. You might have heart issues, vein issues, like we talk about. You might also have kidney, liver problems. Those also will cause swelling in your feet. And make sure you're paying more attention to that and report to your healthcare provider. Small amounts of swelling during walking or after walking or hot weather is normal, but severe swelling is not. So this brings us into the next point. What am I looking for when to call a doctor? You should report to your doctor immediately if one of your leg if you find out one of your legs is swollen, red, warm to touch. Please call your doctor immediately or go see your doctor immediately because that might be a sign of a blood clot and you don't want that clot to travel into any other part of your system, your heart, your lungs. That will cause a huge disaster. So please, if you find that your leg, one of them, swollen, red, and warm to touch, please seek help immediately. A second thing that you need to call a doctor if you find that you're gaining weight, sudden weight gain, shortness of breath. Please get help immediately. Call your provider or go to a doctor. Make sure they check you out. Better safe than sorry. Okay. Another thing is also a swelling that is severe, like your leg just blooms like a balloon all of a sudden, or it keeps coming back, like it's swollen today and it goes away and tomorrow it comes right back. Please seek help. Let them check it out. Make sure that let them figure out a reason for it and get you taken care of. So now, what are some of the tips that what can you do to prevent this or to help the swelling? What you can do to help the swelling in your feet is to elevate them. When you get back home, most people have recliners. Just put your feet up, raise it high up above your heart, 15 to 20 minutes a day. That should help reduce the swelling in your feet. If you do not have a recliner, use pillows. Put the pillows underneath your leg to kind of elevate it a little bit. That would be of great help to your legs. Another thing is you wearing compression stockings. I found that most people do not know that compression stockings have sizes. Please talk to your provider. Make sure that you're wearing the right size. They're giving you the right size and then put it on properly. And it helps. It helps bring the circulation back to your heart. It brings blood back to your heart. So please get a good one. Get your provider to give you the right size. Another one is reduce your salt intake. Like we said, salt causes it, reduce salt. Simple, right? But yeah, reduce your salt intake. that should help because they say where salt goes, water follows. So if you're reducing the salt, you're reducing the water that is being poured in your system. Another thing that sounds counterintuitive is staying hydrated. Staying hydrated actually helps your body release excess water because it's not holding on to water thinking, oh, there's nothing coming. But if you stay hydrated, your system is able to release water. It's not holding on to fluid. But also one thing I would say here is that for patients who have heart failure or kidney failure or stuff like that, most of them are on fluid restrictions. So make sure that you know your fluid restriction number and keep to that. Follow your doctor's orders, okay? But stay hydrated. Follow your doctor's orders. All right. Another thing is wear comfortable shoes. Don't wear shoes that are too tight. Once it's too tight, it's impeding your circulation. Your toes are stuck in there. It kind of increases the swelling in your feet. People also wear socks that are so tight, especially I've taken people's socks and I find a ring right there. Please, please, please don't wear socks that are too tight. It stops your circulation and it causes your feet to swell. And also remember, one thing I should say is that these tips help with mild swelling. They don't replace medical advice or anything. Like I've kept saying, always talk to your provider. Make sure that you guys are coming with a care plan that works for you. A bonus tip for this channel. Check your feet always, okay? We are all about the feet. Check your feet. Make sure you're looking for redness, swelling, blisters, and reporting to your care provider, to your nurse that comes around, to your doctor, to whoever that needs to know to get you taken care of. Make sure you're talking to somebody, okay? And also make sure to moisturize your feet and keep them healthy. If you find these tips helpful, make sure to like, share, subscribe for more food care tips from a nurse. And I'm Carolinda again from Extra Step Food Care, helping you keep every step healthy and strong. Bye-bye.